Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your healthcare. Here we are.
Here we are.
All right. So this is Sex on the Floor podcast. I am Dr. Molly Hart.
And I'm Dr. Katie Schubert.
And we are going to try to educate the public all about sex, both in the emotional realm and in the physical realm. So that's what we're trying to help with. Katie, can you tell our listeners what your degree is in, what you specialize in, so they have an idea of what your expertise is?
I am a certified sex therapist in Florida. I have a doctorate in sociology and gender studies, and then a master's in the same thing, and then a second master's in clinical mental health counseling, and then postgraduate work in sex therapy, which allows me to call myself a sex therapist. So I see individuals, I see couples, I sometimes see families about issues surrounding gender and sexuality.
Wow, that's so awesome. I love that you did all that. So you have two master's degrees. You have your doctorate degree, and then you did additional work to become a sex therapist. Can you talk about that a little bit more? Because I don't know about that.
In Florida is special in that certified sex therapists have to have an additional year of postgraduate studies specifically in sex therapy. So whereas most therapists have their master's degree and then they go into practicing, if you're a certified sex therapist in Florida, you have to have had an additional year on top of your master's that educates you specifically on sex therapy and how to work with clients about sex and sexuality and gender and everything having to do with those topics.
Wow, that is super, wow. And then, so what does that look, so that's a year extra. What does that look like training wise for you then? Are you doing a lot of like research, class work? Are you doing a lot of experience work out in the field?
I see a lot of clients. My private practice is completely booked up at the moment. But I also teach at the University of Tampa, and the class I'm teaching right now is clinical sociologist. So I'm teaching undergrads how to apply sociology in a way that therapists would.
Okay. Wow.
Yeah.
That is so cool. Yeah, I know you have your own practice there that you're expanding, and right now you're the only sex therapist there?
I'm the only sex therapist, but pretty soon I'm in the process of opening up a group practice. So I'll be I'm a sex therapist in the group practice, and I'll be hiring other therapists. I'm in the process of hiring other therapists to see other clientele.
Okay.
So, we'll have a yoga studio on the premises too. I think that it's really important to emphasize the mind-body connection in therapy,
Yes.
as you well know. And we'll have art therapy. We'll have all sorts of different genres of therapy.
Wow, I am so excited about this. Okay.
Okay,
so I think I've talked to you about this before. You work with all ages, all sexes, as far as your expertise. What would you say in the sex therapy world? Is there other little niches in it, or does most therapists keep it pretty broad?
There are specific types of sex therapy. So some sex therapists will focus mostly on couples. Some will focus mostly on individuals. There are therapists in this community that work a lot with like the transgender community. But really, I mean, there are so few sex therapists around that we tend to see all of those groups.
Yeah, you can't really individualize or specialize in one small area because the community needs you as a whole.
Yeah. I think there are 3 or 4 of us in the St. Pete area, maybe a handful more in the Tampa Bay area.
Wow. Okay. And then what's the name of your practice?
It's Cypress Wellness Center. It's the group practice. But my website is drkatieschubert.com.
Okay. So that's how we find you, like on the internet, on Google. And then what about Instagram and Facebook? Are you
It's all the same. Yeah, Dr. Katie Schubert. It's on Instagram, it's on Facebook, the website, and then the Cypress Wellness Center. If you just type that in, it'll bring you to my Dr. Katie Schubert page for now, since the group practice isn't well defined at the moment. Okay.
All right. Cool. Those are all my million questions for you.
Cool.
So we can talk, of course, after we're done introducing ourselves, we can both talk about some other little specifics if we want to in this introduction.
Yeah. So tell me about your credentials.
All right. So I'm a pelvic floor physical therapist. So in the physical therapy world, now it is required that you have to get your doctorate degree in it. This started in 2017, I want to say was the last year any programs allowed for a master's degree. So you've got your undergrad. My undergrad is in biomedical sciences, and I went to University of South Florida for that. And then I went to University of South Florida again for my doctorate degree in physical therapy. Now, unfortunately, in the PT world, there is little to no education about sex therapy, about the pelvic floor in general. So if you want to know and specialize more in that, it's all stuff you're doing after you're graduating. So kind of similar to yours is what it sounds like. So I think in our program, we maybe got 10 hours of education on the pelvic floor area. And it was really just to, I think, make us aware that that was something you could specialize in as a pelvic floor PT. And so I saw those classes. That was with Dr. Shane Terrence and also Dr. Samantha Martin, who are in the Tampa Bay area. And Shane Terrence is a guru when it comes to the pelvic floor. And she just inspired the heck out of me. And I was like, this is what I want to do. So before I graduated, got a job lined up where I was going to be able to have mentorship under Sam and Shane and other pelvic PTs in the area, and got my classes underway. So in the pelvic floor world, there's different ways that you can become certified as a pelvic floor physical therapist. We have something called the American Physical Therapy Association that has a set of coursework that you take. And there's another pretty popular one called Herman and Wallace. And so if you're going to go to a pelvic floor physical therapist, you want to see that they've done their training in one of these 2 realms, because there are, unlike you guys where you're saying you had to do a year of work to be called a sex therapist, you don't have to do anything to be called a pelvic floor physical therapist. So I could have 0 training in it and say that I'm a pelvic floor physical therapist.
So there are people that go through those 10 hours and then they graduate and they call themselves pelvic floor PTs?
They could. And so unfortunately what happens is sometimes there's very unqualified pelvic floor physical therapists who are doing treatment that, in my opinion, they should not be doing whatsoever, or they're not as specialized and skilled in it as they could be. So then patients will go to them thinking they got pelvic floor PT, and when I hear about their treatment plan, I was like, wow, that person did not know what they were doing whatsoever. So that's only that I would say stinks about it. I wish we had a little bit more regulation on that. So I chose the American Physical Therapy Association and took all of my classes for that. And then from there, you can, eventually they're going to actually make it to where it's a board exam you can sit down for and take, but that was supposed to be created this year, but I don't know, with 2020, everything is a little bit delayed.
Yes, it is.
So yes, what in a pelvic floor PT, Another thing is people have no idea about us. I think people know about sex therapists, right?
Oh, I mean, yeah, they get us confused a lot with the more the more hands-on realms of sexual professions. But yeah, I mean, there are people who know about sex therapists as being a specialty, but there are many people that don't.
Yeah, so that is still a barrier for you guys, where people have no idea you even exist.
I think it's less of a barrier for me than it is you, because when I tell people about your profession and that you're a pelvic floor PT, I always get a million questions, and I'm like, I don't know how to answer this.
Yeah. Oh, good. So I know I'm so excited to learn more about each other, because then we'll be able to just help each other out so much. Yeah. So that's my background in training. I then decided to open up my own practice, Pelvic Balance Physical Therapy, because they work healthcare providers like animals in most clinics, and you're just seeing patient after patient after patient, and you get really burnt out. I'm sure you can relate with that. And so I decided I needed to go online and educate women and go out in my community and educate them. And I was not going to be able to do that unless I had my own practice. So here we are. Now I've got Pelvic Balance Physical Therapy. I've got myself, and Dr. Jordan Lindblom is another physical therapist here who treats. And then we do a lot of online, I do a lot of online treatment, actually all over the world, helping women specifically more than anything on sexual problems that they're having, essentially, or pelvic health in general, which is bladder, bowel, and sexual problems that they're having.
So if you were to say, like, the most common client that you get, like, what's the number one question that you get from clients?
Oh, I don't know that I have a number one.
What are some common complaints that you get from women?
Okay, so with women, I would say especially me, because I, in the pelvic floor world, even further specialize in helping with sexual problems. Mm-hmm. So very often I have women that come to me who are having pain with intercourse. That's like for sure my biggest patient population, but that's because I've specialized in that, and I specifically educate about that. So that's what women are more often coming to me with, and they don't think there's anything they can do about it. And they've been completely ignored in the medical community because of it. And so they just think they're going to live with this pain with intercourse for the rest of their life. Like, that's just the way it is.
Mm-hmm. Now, when women come to you and say sex really hurts, how do you go about figuring out what the issue is?
Good question. So we do a very thorough, often I talk to them on the phone first. So when patients call, I don't have a front staff yet. Do you have a front staff?
No, not yet. It's on the list.
I know. I don't know. It's hard for me to give that up, because I just feel like it's so efficient. I can answer their questions right away and do a little quick screening of whether it's appropriate for them to come see me or not.
Yeah.
But how I know that it's more of a physical problem, is that kind of like, how do I know that this is more of a tissue issue, a physical concern that a physical therapist can help with? So when you're having pain with intercourse, almost always they are going to have additional things such as bladder frequency, bladder urgency, or they'll have discomfort in the bladder, especially after intercourse. Sometimes they're not having pain during intercourse. Afterwards, they'll be like, yeah, my bladder will be so irritated for days afterwards. Sometimes they're having bowel issues as well, like constipation or IBS. And so there's normally this little trifecta, these multiple things that are occurring that they didn't even know were related. They didn't realize that the intercourse was also related to the bladder and the bowel issues that they're having.
Oh, interesting.
Yeah.
So you ask questions like that to determine whether or not it's physiological or psychological.
Yeah. And I don't believe you can separate physiological and psychological. I think the fact that we even believe that these are separate entities is so silly to me, because I'm like, our physical body responds to how we are mentally and emotionally feeling.
Yeah.
So, and I know you know that. So I truly believe we hold so much trauma and so much stress and anxiety in the pelvic floor that that's typically the underlying cause, the root cause of why this happened. But if we don't address the physical and we just address the emotional aspect, then they can still be left with these unfortunate symptoms that are happening. So it's like, yeah, we need to address the root cause, which is where you come in big time, but then we can't ignore these physical problems that have happened.
Yeah, I have a lot of women who also come in and say that sex hurts. And a lot of times when I dig a little bit deeper, I find out that they're like stressed out about having sex. They have a lot of anxiety about sex. They've been taught messages about like shame and sex. So, you know, I'm like, well, you know, I can teach you how to relax, but a lot of women don't know how to control their pelvic floor muscles. So when they tense up, they know how to relax their shoulders. They know how to relax their neck, but they don't understand that connection with their pelvic floor muscles.
Yeah, 100%. They don't understand it. So I always say when we're dealing with any type of chronic pain in the body, this was something interesting. I did a 3-month-long clinical rotation at the James A. Haley VA Center, and I was in this intensive chronic pain program that was ran by psychology. And then the psychologists, I think they saw the patients, I don't know, once or twice a week, but we saw the patients every single day. We put them through an exercise program, all of this stuff, and I realized so much about chronic pain. So I took all of that knowledge and combined it with the pelvic floor. But let me go back why I put that in there. With the pelvic floor, we as women, just the vaginal tissues in general, are so spatially unaware of that part of our body. Like there's zero spatial awareness. And we know from the chronic pain research that as you start to have chronic pain, like let's pretend I have chronic pain in my hand, we start to get changes in the homunculus, which is that kind of spatial body map that we have. And that's just my hand. It'll start to morph, and then we don't have as good of connection. So my hand, my peripheral nerves send a message to the brain to try to process that message. Things start to get what we call smudged in the research. And so that happens with all chronic pain. So I'm like, now imagine a woman has chronic pain in the pelvic floor vaginal areas, an area where we never look, we are not familiar with. I'm like, of course it becomes so problematic and way more traumatizing than somebody who just has pain in their hand. So yeah, I agree with you that women are so disconnected with not even just how to control the muscles. They don't even know their own anatomy down there. Do you know how many people I have a mirror and I educate them? I have a screen with a picture. It's like it's a drawn picture. It's not a real vaginal tissue, but I will literally like tell them, hey, this is where your clitoris is. This is where the urethra is. This is where the vaginal opening is. Because they often, I find when there's a lot of shame and trauma, they don't even know those different anatomical landmarks.
Yeah, and then the problems become cyclical, right? They may have started out with some shame and trauma, and then they never get acquainted with their anatomy, and then they have more shame and trauma that follows.
Yeah, and so it's this horrible downward spiral.
Right, yeah.
You're like, so you're dealing with these intense emotional concerns.
Oh yeah, I mean, and the shame and the trauma isn't always, you know, something that she experienced in the past. A lot of times, and I know we're talking about women here, but we both also treat men.
Yeah.
A lot of times the shame and the anxiety and the stress come out in the relationship. So I have couples who come into me for sexual issues. You know, we're not having sex. We haven't had sex in years. Or, you know, she'll say sex hurts, or he'll say he can't get an erection. And although I would like to stay on that topic forever and talk about that topic forever, I can't do that because there are usually other issues contributing to that. They're not communicating well. They're not fighting well. Or they're not talking about sex. She's not explaining to him where her clitoris is or what she likes sexually because she doesn't know. Yeah. So a lot of these problems are very cyclical in nature. And
so you're having those hard conversations with the couple.
Oh yeah. Yeah. And they are difficult.
That's so great because people come to me with those questions, and every time I'm like, you need to go see Katie. I can't tell you how many times I'm like, you need to go see Katie. But I would say there's such a disconnect in the communication. I agree with you where it's, and so they want me to do the communicating for them. They're like, can you tell him, can you text, can you send an email saying this?
Yeah.
I mean, I'm like, how about I CC both of you and we all talk about this together? Or I have them come in, or I have them come and do a Zoom call in the middle of the session, because I'm like, we have to talk about these hard things. One thing I'm sure you guys talk about, and I always like to separate this, is there's emotional intimacy and then there's physical intimacy. And I definitely am trying, when I work with people, with women and men, is I'm helping with that physical intimacy problem that's happening. Okay, like what problem are we physically having? But if there is an underlying emotional intimacy problem, we cannot even begin to touch the physical, because it's just they're just destroying each other, and the emotional intimacy problems are preventing the physical intimacy from even occurring in the first place. So I'm sure, like, can you elaborate more on that emotional intimacy aspects with your couples and women?
Yeah. I mean, the biggest thing that I see that's related to sex, and it might sound strange, but how well a couple fights. If a couple can fight well, respectfully and lovingly, they don't usually have issues that follow them into the bedroom. It's when couples are using sarcasm when they're fighting, or when they're calling names, or when they're raising their voice, or when they're stonewalling, or when they're gaslighting. Those are when you see problems in the bedroom, because you're not going to want your partner to touch you if you can't get through like a conflict, or even like a simple conflict. So usually I start out with couples teaching them how to talk, communicate, how to listen, how to validate, how to fight. And sometimes that's all it takes for them to start having sex again. Sometimes it's fairly easy. And then other times the problems are a little bit deeply rooted.
Okay. That's so great. So once you really address these emotional intimacy problems because of communication flaws, I would say most relationships, the problems come from poor communication, poor arguing, poor fighting. When you address that, you often find that the physical intimacy naturally kind of becomes more regular, more normal.
Yeah. And also, if a couple's fighting well, then they can talk about other issues like, this is where my clitoris is, or I like it when you do this with your hand, or I want more foreplay. When they can talk about other things, talking about sex gets easier because you feel safe talking about sex.
Yeah, no, that makes complete sense. Love that you do this. How many, now this is, I know, not going to be a clear-cut answer, but when couples come to you, and because I think a lot of couples come to you because they're not as sexually active as they would like to be.
Yeah, I get a lot of those.
Yeah. So if say the couple comes to you, and is that typically the male wants to be more sexually active than the female, or not necessarily?
I get both.
Okay.
A lot of times we just call it desire discrepancy, where one person desires sex more than the other person. In a lot of the situations, we just have to find a compromise that works well for both people. And I say to most of my couples, it's not a perfect world. You guys aren't going to be 100% satisfied probably with your sex life, but you can be 90% satisfied or 80% satisfied, but you need to be able to talk about it, right? We need open lines of communication to find that compromise to begin with.
Yeah. Yeah. So a lot of it really comes down to the communication.
Oh, yeah. Yeah. I mean, communication is the foundation for any relationship.
Yeah. You're 100% right. I love what you do. It's so wonderful. Tell me this, when people come to see you, how often typically are you seeing them?
I start out hopefully more frequently. I like to see people once a week initially. And then as we move forward, I like to give lots of homework, things for couples to do, for individuals to do at home. So once I'm able to throw a whole bunch of things at them to practice at home, then we can go longer stretches without seeing each other. But initially once a week, so just so I can get my hands on them, I can figure out what their issues are, I can get a good sense for what they need from me.
Yeah, that's so good. That's what I was saying. You have to, I'm the same way. I front load care and then I space it out, because otherwise you can't really get an idea of what's going on.
Right. So you usually see clients once a week as well, initially?
So Right now, the way I have it structured is I pretty much always do 8-week plan of cares with all of my patients, because with physical problems, like a true physical problem, let's pretend we have a strength issue. So like another part of my clientele I see is especially postpartum women, or women who are having stress incontinence where they're leaking urine, or they'll have prolapse symptoms where their pelvic organs are starting to come down the canal. That's just a basic strength training issue. But in order for muscles to grow in mass, you have to have at least 8 weeks minimum to be doing a program to see changes in it.
That makes
And
sense.
then think about it too, like let's pretend you break your bone or you twist your ankle, like a real bad twist. It takes, give or take, around like 6 to 8 weeks for tissues to heal, all tissue types. Now, if it's really severe, it could take longer. But like if you break your bone, I break my bone, it's going to take at least 2 months. We're probably going to be in a cast, let's say. So I always say it's going to be an 8-week plan of care. When I am treating patients who are having pain issues, like more persistent pain, especially that vaginal pain, bladder pain, bowel pain, I see them twice a week for the first 3 weeks. And then I only see them once a week for 3 weeks. I actually totally skip week 7. That's their accountability week to make sure they're doing all of their homework. So I slowly taper myself away because they're responsible for more and more of their care. And then week 8 is typically my last session with them. And we just talk about what things need to continue to look like, or maybe they're fully better. Like some of my patients, if there's no emotional intimacy issues,
Right.
if it's truly just a physical issue in the pelvic area with pain with intercourse, easily within 8 weeks, they are all better. Like I have no problem. So week 7 is, I call it sex week. So week 7, they are typically able to have intercourse with their husbands at that point. My male patients, same thing. I'm like, let's go home. Can you guys have intercourse? And this is my favorite part of my job. I go, okay, after you guys have sex, I need a text message. I need you to email me something. Let me know how it went so I can figure out whether or not like we're ready to be discharged. And I would say majority of the time, as long as there's no significant emotional intimacy issues happening, I get this message of like, oh my God, we had sex and it didn't hurt. And they can't believe it. Like they're so surprised because they've only ever had sex with pain. And it's my favorite message in the world. Like I do a little dance in my house every time I get these messages. So that's typically what my plan of cares kind of go down that pathway.
Well, that's awesome. Is that fairly typical for a pelvic floor physical therapist, the 8-week thing?
No.
Okay.
No, I just created that myself. So you know how you're like probably super overbooked?
Yeah.
Right? Are you on a wait list?
I try not to be, but because of that, I find myself working too many hours.
Yeah, same thing. Okay, yeah. Same thing. So, and then you and I are fee for service. We don't take insurance.
Right.
So most pelvic floor therapists who are under insurance, when I was under insurance, we had 2 pelvic floor PTs. We were on over a 3-month wait list each. So why am I bringing that up? I'm bringing that up because at the time, my boss would not let me stop putting new evals on the schedule. And so I would get somebody on my schedule, I would do their eval, and I couldn't see them for 3 months. And so we would hypothesize how many sessions we needed, and we would put them on the schedule whenever they could fit on there. So what ended up happening is we had this like ridiculously horrible haphazard schedule. And so it was taking me 6 months to get people better. And I didn't know any different because I was a new therapist. I didn't know that people could heal so quickly. So when I started my own practice, I started doing things differently and I didn't have that barrier of the schedule in the way. And I was like, oh my gosh, people can get better absolutely in 8 weeks if you have this consistency with care. But other pelvic floor PTs in the insurance-based world, it is very rare that they're able to get in to see them enough to have that consistency. And their sessions are shorter because we get reimbursed so low from insurance. So their sessions are like 40 minutes long. And so no, it takes, I would say majority of the time, it's much, much longer of a length of care. In the typical pelvic floor PT world, when women are dealing with that, if they ever even fully get better. I find that a lot of women don't fully even get better in that traditional setting.
Oh, well, this has been super informative. and I'm looking forward to continuing this podcast with you. We plan on getting some specialists in to help with this process. Both Molly and I think that sex isn't discussed as readily as it should be. And the goal of this podcast is to talk about it, to normalize it, and to educate.
Yeah, I'm so excited to work with you. And hopefully we can bring on experts. We can even maybe go through different research studies and just talk about what those mean and what we see clinically with our patient client and so forth. Yep. So anything you wanted to add, Katie, that we missed?
I don't think so. My kids just got home because of COVID, and we don't have as much childcare.
That's
so
okay.
I'm expecting one to bust in the door at any time.
Like, do you talk about, how old are your kids?
2 and 3.
When do you plan on talking about sex with your kids?
As soon as they can understand it.
Okay, I love that. We'll have to have a whole conversation, a podcast about talking about like intimacy with your children.
Oh yeah, we will. I mean, it's such an important topic, and parents don't know what they're doing when they're thinking about it because, again, of the anxiety, the stress, and the shame around sex in our society.
I mean, we can't even barely talk about it as adults, let alone with children.
I know. No kidding.
Well, this was wonderful. I am so excited. We are going to try to do one podcast every 2 weeks. So the goal is to have about I think this was like 45 minutes. So about a 45-minute or so podcast every 2 weeks on different topics. And then hopefully we start having people writing us and telling us what they would like us to talk about. And we can just expand it from there.
Yeah, perfect.
Okay. Bye, guys.
Bye.
We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert, on Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, you can find us at pelvicbalancept.com and at drkatieschubert.com.